We've all heard of a hernia, but how do you know when you have one, and how do they even happen? Here to answer those questions today, including treatment options, is Dr. Kyle Seudeal, a general surgeon with Franciscan Health. Thank you so much for joining us.
Thank you for having me.
So first of all, what exactly is a hernia and how do they develop?
So the hernia is the easiest way to describe them. They're essentially holes in the abdominal wall. So sometimes you could be born with these, but most commonly they develop over time. So our abdominal wall can have some areas that are weak at baseline, and then over time those areas can get weaker to the point where a hole forms.
Will you know when you have one?
Not always. You know, if they're very small, you may not have any symptoms related to it, and it may be picked up if you were getting a CAT scan for something completely unrelated or an ultrasound, something along those lines.
What are the most common symptoms, and are there symptoms more prone to be felt by men?
So the most common symptoms that people experience are pain, or they notice a bulge in the abdominal wall. So when it comes to the pain, a lot of times what people will report is the pain will tend to increase with activities. So if they're doing some heavy lifting, or let's say they're out on their feet all day or so forth, they'll notice some more discomfort. With regards to the bulge, they'll also notice, well, hey, as the day progresses, that area seems to get bigger over time. And then once they're back home, they're resting, relaxing, that bulge starts to go down and sometimes goes away. And then the next day, this kind of cycle repeats.
Yeah. So what are the treatment options?
So unfortunately, when it comes to hernias, that hole that's formed, it's never going to go away on its own. So surgery is really the only cure, so to speak. Now, when you're talking about surgery, we have different techniques that we employ to fix these. So there's the traditional open approach, which is essentially wherever the hernia is, we make an incision over that, and we fix the hernia kind of from the outside in. Okay. The more recently, though, we've adopted a lot more minimally invasive techniques. So either laparoscopic or, my preference, robotic. And essentially what that is, you make a few small cuts, maybe about ½ centimeter to 1 centimeter. You go in on the inside and you fix the hole from the inside.
What's recovery like?
So most of these surgeries are same-day operations. So folks come in, they get the operation. As long as they're doing well, they get to go home. Sometimes for larger hernias or patients who have more complex medical problems, they may need to spend the night in the hospital, but usually they're home the next day.